I got up from the chair and I collapsed. Checked my pressure, it was 80/60.
Coming from a fully qualified doctor, he's talking about basic lifestyle medicine.
You need to use supplements with a specific purpose. Don't just use vitamins because vitamins are good. Each vitamin has a purpose. Cholesterol is a big market, $60 billion market for cholesterol drugs.
Is your doctor keeping you sick? Now, what inspired you to write this book?
You're looking at only what is the cause of the heart disease. You're not really looking at the rest of the body. You're not looking at what your stress levels are.
I'm sure healing takes a lot more time, and a lot of times it's not even there.
And this is a message through your podcast to every trainer in a gym. Guys, you're messing it up.
Look at the person as a whole, not as a patient.
Anyone above the 120 mark is diabetic. But I know for a fact that even at 140, patients are doing fabulously well.
A scientific understanding is far more important than just run-of-the-mill advice, especially that social media advice that goes on.
You're letting your health be in somebody else's hands, and that's a disaster.
There's a mechanism in your body that if you don't look at the labs, if you don't look at the reports, this mechanism in your body will tell you how good you're doing.
And of course, the environment that you're living in is toxic in every way possible. The air that you're breathing is bad.
So safe to say, women are more of hormonal creatures than men.
Going to the doctor is important when you know that you're not feeling good.
If a person is not treated as a person, if they know they're not getting the care and the empathy that they deserve, then I think that's a whole element of healing missing, isn't it?
Absolutely. And that was one of the major causes of so many deaths during COVID, right?
Modern medicine today has definitely increased the lifespan, but has it increased the quality of our lives? Has it increased our health span? Welcome to Ageless, the podcast where we explore science-backed strategies to look, feel, and live younger. I'm your host, Warun Mehta, and today I have an incredible guest whose life's work has helped thousands defy age, reverse disease, and reclaim vitality. Dr. Lenny Da Costa is a consultant geriatrician, preventive cardiologist, and one of India's most respected voices in anti-aging and functional medicine. With over 30,000 patients treated, he's a pioneer in integrative approaches like chelation therapy, IV nutrition, hormone balance, and regenerative care. If you're in your 40s or 50s and wondering how to truly slow down aging, improve your energy, skin, heart health, and even reverse early chronic diseases, don't miss a minute of this episode. How are you today?
Oh, great. Feeling great. Good to be with you, Warun, after so many years.
Thank you. I know it's been a while. We've connected actually quite a long time. So what's been new in your life and in your practice?
Oh, a lot. So I think we spoke about how I started this whole journey in functional medicine and anti-aging medicine those days. It was primarily to help my own folks, basically. My mom, who had a heart problem, and nothing seemed to come out on any of the diagnostics. My dad had his own metabolic issues, being a doctor, and he never believed there was another side other than modern medicine. So that's how the journey started. And we generally dealt with people with chronic disease till about the time when COVID came in. We wouldn't see that much of, say, autoimmune conditions, that many patients coming to us with fatigue. Fatigue, what I mean by fatigue is real fatigue. They can't work anymore, especially women. We should not see that. But post-COVID, I think the entire demographic has changed. We do have the same chronic illnesses that we see, but we see people much earlier now with the same problems. We see young kids, 35, 40, we call them kids because they're not supposed to have diabetes and heart disease and hypertension at that age, and they do. And we see young women, young girls with PCOD. Of course, we used to have a good number of them earlier, but that number is kind of exponentially grown. We have people who come into us and say, chronically fatigued. I mean, I treat 2 or 3 cases, new cases, every week of chronic fatigue in women. And you won't believe it when you look at their labs, because the first thing I do is I wouldn't want to see their labs. A detailed lab report never lies. Your blood never lies. It tells me what your current physiology is and where the problem lies. And if you look at it, you can see how badly stressed they are, because their cortisol must have been very high. Now they have just crashed. And so the entire adrenal function is crashed. Along with that, even though they have normal TSH, T4, which are the normal thyroid hormones, which everyone tests for, their FT3s are low. So their thyroid function itself is not happening. And most of my colleagues in modern medicine don't catch this. And guess what they are given? They're given antidepressants because they think they're suffering from depression. So that's the sad thing that I see on a regular basis, which we used to not see so much earlier. I mean, this was a condition that was, kind of condition that we used to see in British women, because that's how I treated most of them. They used to come and live in Goa because they couldn't work anymore. We wouldn't see that in Indian subset, but today we see a lot of them. And that is a huge change. The other huge change that I'm seeing in my practice is the number of cancers that have gone up. It's phenomenal. I mean, young people getting cancers. And you were wondering, where was this? We have not seen this kind of growth of cancers before. And these are virulent cancers that just kind of go have hammer and tongs on your body just like that. So you don't even get a chance to treat some of these patients. Many of them not responding to normal treatments. And then you don't even talk about diabetes and hypertension. I mean, that's like every day you see new patients coming with it. But it's kind of just, the graph is just shot up. We don't know what caused it, whether it was the COVID infection per se, or whether it was the COVID vaccine that caused it. We don't know. I mean, time will tell, because now there's a lot of more data coming out, and we know that there are people dying of heart attacks because probably the COVID virus or the COVID vaccine, which actually puts the virus back in you, can cause those microclots. But we don't know. We don't have definite answers for this.
That's very disheartening, how all this is happening earlier and earlier and how it's exponentially increasing. So I want to step back a little bit to the start of your career. What made you choose medicine as an option for your career in life, and then later on move to functional medicine?
Yeah, so my dad was a doctor, and I kind of was always intrigued by the power a doctor had over disease and the body and the way it functioned. And so even when I did my first MBBS, I did very well in both my biochemistry and physiology, which actually tells you how your body functions. And if you have those bases right, then it becomes very easy to go get into functional medicine. But once I finished, I was a little disillusioned. Why? Because all I was doing was writing prescriptions. I had people coming with hypertension and diabetes, and all I was writing was prescriptions, and things never got better. They got worse. So I would add the number of medications. So this didn't look very nice to me. I mean, it didn't fit well with me, and I wasn't satisfied. And then the case of my mom came up. She had these 2 episodes of her heart. So she did the normal thing, went and got an angio done, and there was nothing in the angio. So why did she get a heart attack? So that got me thinking that there's a world beyond what I know in medicine and what we are taught in med school. And as I started searching for it, I mean, it was just out there. There was enough and more literature in modern medicine that told you that there are alternatives that are available. And that is basically what functional medicine is today. You use those same alternatives to change the way your body functions. Rather, take it back to where it's supposed to be, functioning normally.
Amazing. I just want to acknowledge you there, because the very fact that even as a doctor, as a fully qualified doctor who did his time, must have spent 5 to 7 years before he started practicing. And even then you stepped back and you went like, there's a world beyond medicine. And you went out and started learning about that. I just wanted to acknowledge you for that, because not a lot of doctors and not a lot of specialists would actually admit to themselves that there's limitation to what they know. And I think that's why we're here as well. So kudos to you. Now, for the viewers, why we're talking a lot about chronic disease here is because although the podcast is ageless, the fact is you cannot have a good quality of life or a healthy lifespan if you're suffering from early onset or even delayed chronic disease. The very fact that you have chronic disease or there's onset is going to affect the quality of our lives. So we need to make sure that we have tools to manage or reverse those or even prevent. As Dr. Lenny was saying, it's happening more and more exponentially, so it's very important for us to know the reasons and the causes. So before we move further, I want to talk a little about the aging part. Doctor, What are the root causes of aging you see most often in your patients? I'm talking about accelerated aging.
Okay, so aging has a lot of theories. But the one that actually can be proved to a large extent is what happens with our environment around us, right? So there are 2 or 3 things that happen. One is the oxidative stress. That puts on a lot of stress on your body. That can cause accelerated aging. How? Now the exact way is, or the exact theory of aging that applies here is your hormonal balance. It is never the case that you age and your hormones decline. It's because your hormones decline, you age. So you could be 60 having the hormones of a 30-year-old and absolutely have no problems. But you could be 30 and have no hormonal balance absolutely and have a body age of 70. And that's exactly what we are seeing. Now, why do these hormones start playing around like this, especially when it comes to aging? Number of factors. The first one is our lifestyle. Second is the environment that we are in. And the third, and the most important, is the food that we eat. So all 3 play a huge role in the entire aging process. Now, when I say your lifestyle, you need to understand this body a little differently from what we see today. This body is the same body that we had 70,000 years ago. It was not meant to be in this beautiful room. It was not meant to be in an air conditioned with lights and fan. It was meant to be in a jungle. So your body was made to survive those tough conditions. Now, what were you doing then? You were either running away from being somebody else's food, or you were running away for your own, or running for your own food. So you were always active. You were always exposed to nature. Now, what did nature give you? It gave you a lot of things. It gave you far infrared rays of the sun. It gave you electromagnetic radiations from the waves from the earth. Now, these are things that help the body live a normal life. You change that. But worse still, you don't even move today. And when you do, you get to the gym and do a 2-hour workout till it kind of destroys everything that you have in your body. You see, everybody thinks that if you do a marathon, it's a very good exercise to do. Please remember, the first marathoner who ran a marathon reached his spot, gave his message and died. And if you actually look at data available from the Boston Marathon, done in the Massachusetts Hospital in the US, look at that data. Every marathoner who finishes it shows changes in the heart muscle that are similar to when you get a heart attack. So you were never meant to do kind of elongated workouts. You had the push to do a sprint, run away from danger, or run for what you want, and then you would slow down. So lifestyle in that way has hit us. The second thing as far as lifestyle is concerned is when you actually did all of this 70,000 years ago, you did it during the day. The sun went down, it got dark. You were there, you slept where you were. And so in the night, from being in a flight or fight mode during the day, in the night you went to rest and regenerate mode. And how did you go there? Because the moment you went to sleep, within 1 hour, you had 2 hormones that get released in your body, melatonin and growth hormone, both of which are basically to build your body back. Right? How do we know that today? Because melatonin can prevent cancer. Growth hormone repairs you even when you have a stroke. These are the 2 things that we don't do anymore. We get home, we are on our phones, we are on our TVs till about 10:30 at night. Worse still, we have got beautiful lights in our rooms, which are LED. All of this blocks the pineal gland from releasing the melatonin. You don't get into bed by 11, you don't get any growth hormone. So you could go to sleep at 2, 3 in the morning and sleep till 10 in the morning. It doesn't mean the same as sleeping at 11 in the night and getting up at 7 in the morning. That rest and regeneration is not there. The first reason for aging, because you go to sleep late. You don't sleep well, you don't exercise regularly. Food. Why is food bad? First, the entire food chain is poisoned with heavy metals and a lot of other crap. Fertilizers, pesticides, and the groundwater is poisoned because of this. So your food, your plants do not have what they need to have. They have a lot of this crap. Second, please understand that the top layer is already gone. You don't have the minerals anymore. So even if you're having the same food that your great-grandfather ate, you're not getting the same minerals. Why do you need the minerals? Every hormone in your body needs a mineral to get it activated, for God's sake. Where do you get these minerals? From your food. Now you're not getting them. End result, you're aging. And then you eat the wrong food anyway. You were never meant to be a farmer. You were a hunter-gatherer. You became a farmer 10,000 years ago. And that's when the crap in mankind happened. All the problems that mankind have today is because we became farmers. So you cut the grains out, at least you'll get some part of that back. Right? We lived 250 years before we became farmers. That was our lifespan. It became under 100 when we became farmers. Right? So that's as far as your food is concerned. And of course, the environment that you're living in is toxic in every way possible. The air that you're breathing is bad. You're getting the heavy metals in your body through the air as well. The lead, because of all the gasoline, leaded gasoline we had, always troubled us. So your air, food, and water is poison. These are the reasons for your aging. Now, most people will say, why is it that my brother doesn't get the same problems that I do? We are in the same environment. Yeah, because his body is able to get rid of the toxins a little better than yours. See, it's never the genes that cause disease. It's the epigenes or the epigenetic factors, which is basically your environment. Right? So if you are able to sleep well, eat right, exercise daily, you will definitely add 10 to 15 years, the simple things, 10 to 15 years of quality, healthy years to your life.
That's really amazing and enlightening information. Thank you. One of the things that you alluded to earlier was oxidative stress. So could you explain to our viewers what is oxidative stress and how that contributes to accelerated aging?
All right. So oxidative stress is nothing but rusting. Now, if you leave iron outside in the air, oxygen or the air will cause it to rust. So when you get heavy metals in your body, the first thing that happens is you use a lot of oxygen, you have a lot of water. That causes the biochemical reaction which causes the oxidative stress. So the moment you have these heavy metals getting into your body, whether it's from your food, water, or air, it reacts with oxygen, it reacts with the water. Water is H2O basically. And it creates something called reactive oxygen species. Reactive oxygen species are nothing but those that start damaging your cells. Now you need some amount of oxidative stress, like for example, a mitochondria, where the energy for the body is made, there's a lot of oxygen used. So it will create some amount of oxidative stress there as well. Wherever oxygen is used, there is amount of oxidative stress that is created. But that is required for the body. So some amount of stress is always good. But when you are overwhelmed with oxidative stress, because there's so much of heavy metals in you, that is when your body starts not working or functioning the way it's supposed to function. Most importantly, what happens in oxidative stress also is many of the hormones are not activated the way they're supposed to be activated. Secondly, many of the receptors on which the hormones are supposed to work are blocked by heavy metals. The other thing about oxidative stress is also this. Now look at it this way. Everybody looks at cholesterol to see that you've got heart disease, right? But cholesterol is not the villain here. And it's not the bad guy here at all. If you don't have cholesterol, you'll die. Cholesterol is every cell has got a cell wall. That cell wall is made of cholesterol, right? So when the cell gets sick, it kind of bloats up. To repair it, the liver has to make cholesterol. It doesn't come from your food. Only 20% comes from your food. So when the liver makes this cholesterol, it sends it on a vehicle called LDL. Now LDL is not harmful. It's just a vehicle that takes it to the site where it's supposed to be used. If it is not to be used, it will come back on another vehicle called HDL. So why is good and what's bad? Both are good. Now the problem is when you have oxidative stress, this LDL gets rancid. It gets oxidized. And then it doesn't go to the cell and give it where it's supposed to. It goes to any cell and bombards it and creates damage to the cell. So oxidized LDL is bad for you, not normal LDL. So this is one of the signs where oxidative stress plays a huge role. That's your cholesterol. And we look at the long one. We say cholesterol is high. Let's take something to stop cholesterol. Then we blame all the oil in the world that causes cholesterol. For God's sake, cholesterol doesn't go up with oil. It goes up with carbohydrates. It goes up with your sugar. It goes up with your rice, wheat, jowar, bajra. That is what goes up. And only 20% of it comes from your food. The rest is made in your liver because your body needs it to repair it.
Wow. So what I'm hearing is there's a lot of misinformation out there.
Yes and no. Misinformation because modern medicine has put it out that way. So whether it was meant to misinform or not, I wouldn't be the judge. But as far as the patient or is concerned, yes, he is being misinformed. Yeah, for that matter, some of my colleagues also think the same. They are taught that way. They don't want to go beyond, or they don't even want to go, not beyond, even if they go backwards and look at their physiology and biochemistry textbooks of the first year of medicine, they will know that they are wrong in what they are doing at this point in time. But they don't. It's not their fault, because our guidelines say cholesterol is high, you're supposed to do X, Y, Z. But that is not what a doctor is supposed to be. Doctors are not supposed to go by guidelines. Doctors are supposed to go by what they see and what they think, as per science, they can do to help this person regain health, not manage sickness.
Regain health, not manage sickness. That's quite a tagline. I like that. So earlier you said that the culprits of aging are food, environment. What else was that?
Sleep. Lack of exercise.
Right. So could we add stress, emotional dysregulation, all those things as well?
Yes. So just let's look at stress.
Right.
Let's understand the whole concept of stress. And to understand the concept of stress, let's go back to that same 10,000 years or 70,000 years back. Stress was meant for us to help us run away from danger, or to help us survive for our food, because when we didn't have food, there was no Swiggy, there was no supermarket, there was no kitchen where we could cook. We were hungry, now we wanted to eat. We had to go hunt or gather. So we didn't know when the next meal was coming. So where did we get the energy from during this time? The energy came only from two sources. The earth, that's your electromagnetic waves, and the infrared rays of the sun. The pulsed because we were bare feet and getting the electromagnetic fields, our cells were kept in high energy states. But when we were running, to get that energy, we needed the infrared rays of the sun. Even under shade, we would get this, and the infrared rays of the sun would increase something called subcellular melatonin, which we know now. About 5 or 10 years ago, we heard of subcellular melatonin in modern medicine. Subcellular melatonin increases mitochondria and the DNA of mitochondria, and increases the amount of energy that your cells make even when they are starving. Right? So this is how we would get it. Now, this was how our body was supposed to manage stress. We were running, cortisol would go up. The moment cortisol went up, your entire digestive system was shut down. Your entire hormones were shut down, sex hormones. Your entire immune system was shut down. And it would shut your thyroid function by converting your T4, which is the inactive hormone, instead of T3, which is the active hormone, to another inactive hormone called reverse T3, which we didn't understand till about 10, 15 years ago. We thought it was just parking it there. No, once it gets converted to reverse T3, it doesn't get converted back. It's a one-way traffic. And reverse T3 would block T3 from working as well. So these four things were shut down by stress. Why? Because the body felt that it needed all your energy into your limbs because you're running. Right? So cortisol would increase the amount of sugar that is made by the liver from everything around it. And it would cut down the energy used by the rest of the body for all these different functions. Okay. Now what happens? And then what would happen is, sundown would happen. You would go to sleep. So this whole stress thing was for about 3 to 4 hours. When you went to sleep, it was rest and regenerate. All these 4-5 areas which were shut down would open up again and function normally. Now what happens? You are worried about something. Your cortisol levels start going up. You put your body into a fight or flight mode because we have our primitive brain, which is still there, the limbic system, which puts the body into a fight or flight mode. So all these systems shut down. Your cortisol is high. But now what happens? You go home at night, your lights are still on, you're still working in front of your screens, so you don't have the rest and regenerate phase, and this happens day in, day out, day in, day out. So now your systems are shut down for days together. So now let's see the outcome of these 4 systems shutting down. You shut down the thyroid, you get hypothyroidism or subclinical hypothyroidism, weight gain. Your gut, your digestive system is shut down. You get all kinds of gut issues, including constipation, which also is because of the low thyroid that is there. Third, your hormone systems for the sex, your sex hormones are shut down. PCOD is something that is very common. Early erectile dysfunctions are very common. All right, infertility is very common today. Immune system starts shutting down, and then suddenly it's woken up in a hurry, so it overreacts, and you have got all kinds of autoimmune disorders that you see. So these are things that you see on a regular basis. Why? Because we don't know how to manage our stress. And then it comes down to what? Your bad lifestyle. If you went to sleep at 9, did what you're supposed to do by 9, 9:30, 10, and went to sleep, you would give your body a chance to rest and regenerate. Cut your lights by about 7:38, which is your natural time to cut your blue light, that is your screens. You won't have all these problems. You won't have the issues of stress. Everyone needs stress to survive. But you need to know how to manage stress. And it's very simple. Go to sleep on time, for God's sake. Exercise regularly in the morning, because exercise gives you endorphins, stress busters. Laugh as much as you can, gives you endorphins, stress busters. Be grateful for what you have for every day. Stress goes away. You can't be grateful and anxious at the same time. Right? So it's a hack. I am anxious about what's going to happen tomorrow, but I can be grateful that it's not happening right now. Right? So it's how we see it, whether we see it as glass empty or glass half full, half empty or half full. Very simple. But stress is something that we can manage. But we use stress as a villain and say, because of stress, all this is happening. No, stress is required. But you are overdoing everything with stress.
Mind blown. So what I'm hearing here is that there's a difference between acute stress and chronic stress.
Yes.
And thousands of years ago, our forefathers had acute stress, which lasted 2 hours, 3 hours, 4 hours, when they were running for their food or running away from food or from the prey, right? Or for the predator, rather. And now, today, we live in chronic stress because of all the factors you talked about, due to which a lot of our systems don't shut down. And then we
don't shut down and they don't...
Right. They shut down. Yeah. Correct. So they don't get the rest and regeneration that is required for the body. Wonderful. Wonderful. So here, I want to talk about what are some early warning signs of accelerated aging that people miss in their 40s or 50s. Do you also believe it's possible to reverse those?
Yeah. So one of the first signs that you'll see is weight gain. Central obesity is the first sign. So when you get central obesity and you do a blood test at that point in time, one of your hormones that will go up is fasting insulin. You see fasting insulin at around 10. I'm not talking about the higher rate of what the labs say. If it is around 10 and above, that's your first sign of aging. That's going to lead to a lot of problems. It's leading to insulin resistance. Insulin resistance is the cause of the entire metabolic syndrome. Metabolic syndrome leads to diabetes, heart disease, hypertension, name it. Right? That's your first sign. The second one is your sleep disturbances. Right? And the third one, which you can see most of the women complaining of, is severe fatigue. These are early signs. Even men complain of it, but men tend to ignore it. They think it's a part of life, it's part of their work and things like that. Women can't handle it because the moment their thyroid starts fluctuating a little bit, they start feeling the fatigue. So early fatigue, you can't do anything. You don't feel like getting up and not feeling fresh in the morning. You don't feel like exercising when you were doing it earlier. If you were never doing it, then putting yourself into that grind, you need some time. But if you were doing it and now you can't do it, it's the earliest sign of aging. Putting on weight, despite everything else being normal, is another sign of aging. And then the first clinical sign that you will see is your pressures going up and down, your sugars fluctuating, your HbA1c coming to a borderline, the pre-diabetic phase. Walking becomes a little more laborious. Getting up in the morning becomes laborious. These are signs that tell you that your aging processes are kind of accelerating. The moment your hypertension sets in, then there is no looking back. Everything else starts just adding to it. So the first thing you need to do if you're putting on weight is figure out why you're putting on weight. Now what we do is we have a knee-jerk reaction these days. And it's happening more now than earlier. The moment you put on weight, you run to the gym and start working out for 2 hours. Now, that's the worst thing that you can do. And this is a message through your podcast to every trainer in a gym. Guys, you're messing it up and messing it up big time, right? You cannot have anybody work out for more than 20 minutes a day. Now and especially if you want to lose weight. Let me explain this. The first 20 minutes when you work out, you're burning sugar. Sugar is in the form of glycogen in the muscle. It is free-flowing sugar in the glucose flowing in your blood, wherever. So all that gets over in the first 20 minutes. Then you start burning fat. Now you'll tell me, Lenny, but that's the reason why I'm going to the gym, because I want to burn fat. Yes, my friend, burn fat. But tell me something, what is fat? Fat is reserve energy in your body. Your main form of energy is glucose. Fat is reserve energy. Now, if you take your car, you're driving, it goes into reserve, and you take it to the gas station, and you put petrol, what fills up first? The reserve fills up first. So when you use reserve as energy for your body, the next meal, you're putting it back on. But unlike the car, your body is way different. It has got something called metabolic memory. So it will say, this idiot is going to exercise for 2 hours tomorrow. It needs this fat to be burnt. I'll put on the fat and keep for it. So you go for a holiday, for 15 days you don't work out, it's putting on fat and you gain that fat. You never lose fat with high amount of exercise, right? So when we put on weight, the first thing we do, we run. What happens when you do a 2-hour exercise? It increases the amount of cortisol in your body. Cortisol is a weight gain hormone. When you put on the weight, you have never checked for your hormones. If your insulin is high, it's a weight gain hormone. If for a woman, if her estradiol is high, it's a weight gain hormone. If your cortisol is high, it's a weight gain hormone. Now you could exercise the whole damn day or starve the whole damn day. You will never lose that weight. So there has to be a holistic approach to weight loss first and foremost. You can't have a knee-jerk reaction. So when we say that putting on weight is your first sign of aging, it means not running to the gym to do exercise to lose weight. It means that you need to go to somebody who understands your blood tests and get a proper blood test done with a hormone workup in a functional medicine clinic and understand what is happening in your body before you decide what to do. Because weight gain for you will be different, for another person will be different, the causes will be different, but the weight gain is the same. What you see is the same. Today people complain of non-alcoholic liver disease. Why is that happening? Because we're eating bad. We are eating too much of carbs. We were never meant to be farmers. That's what I said. You're getting diseases because you've just taken your petrol car and put diesel in it. What's going to happen? So the first sign, when you look at it, please don't have a knee-jerk reaction. Please go and investigate why you're getting those signs. Why is your insulin going up? Why are you getting that hypertension? And when you do that, You have ways and means of reversing that when it starts, not 10 years down the line. 10 years down the line, you can reverse a few things, but not everything. You may have a good life going forward and it doesn't go beyond it. So when people come to us 10 years, 15 years down the line, we stop the progress. But reversing it from there is a huge challenge because each one's body is different.
Got it. So just one key distinction there. We talked a lot about cortisol. So you said cortisol is a weight gain hormone. It's also the stress hormone, correct?
Yes.
Right. Also by the logic that we burn for the first 20 minutes, we burn sugar as glycogen in the muscles. And then we get onto the fat, and fat is reserve energy. But don't some people have more of that reserve energy and other people have less of that?
It doesn't matter. No. So the moment you start, so let's look at this, go back to that thing of 20 minutes of workout. So when you burn this sugar in that 20-minute workout and you stop at that, then for the next 12 hours, your body uses all the fat stores. Now these are all reserve energy stores to convert it into sugar. So a high intensity workout for 20 minutes gives you a fat burn for 24 hours practically. A 2-hour workout in the gym or doing a marathon will burn fat only during that time and put it on the next meal. So you choose what you want. It doesn't matter how much of reserve energy do you have, irrespective. Some people don't even have fat, but they have just the right amount of fat to give them that little bit of reserve that they need. But the moment you burn it like this in that intensive 20-minute setup, you start burning it like an afterburn. It's called an afterburn. And you use glycogen in your muscle for the next 12 hours, your fat stores are replenishing it, sometimes even 24 hours. So how do you know this? You look at a sprinter, he's well built. You look at a marathoner, skinny bones, because he's losing everything. He's losing muscle, he's losing everything.
Wow. That makes a lot of sense, actually. And considering all those signs of accelerated aging, is it possible to reverse our biological age, and how does one go about doing that?
Yes. So I have a colleague of mine who's doing a lot of work with biological aging. They're one of the few companies who've been given some $20 million to further research this. So if you look at the aging markers, and there are quite a few of them, right? There are lots of them that you can actually, a plain CBC, which we do for anemia and your cell count, will tell you, some of those markers will tell you that you are aging and that can be reversed. Now, how do you reverse this? See, the simplest way of reversing it is a proper exercise and proper sleep. 90% of the times, we can't do this. And that's where the challenge is. But if you can, it reverses your aging and reverses your body age like anybody's business. Now, I have done it for quite a few people, but I did it for myself and I was amazed when I did it for myself during the COVID break. Prior to the COVID break, I was taking 4 antihypertensives. Whoa. Right? And 3 anti-diabetic medications. One of the reasons why I was not getting that down was, despite having exercise every day, was because I used to sleep late. I was traveling late in the nights. I was taking 4 flights a week. That was part of the reason, because when you fly so much, just traveling on a flight so much causes oxidative stress because of the way they pressurize the cabin. Now, I started working out every day. I didn't have any work to do, so I used to get up in the morning and I started working out. I had a kind of a definite morning routine. I said, let me try this out. And I would work out for 20 minutes every morning. It was high intensity, 20 minutes, finished, done, dusted, have a good breakfast. So I had completely streamlined the way I lived my life. 6 months down the line, I was doing an online session for some doctors. It was an online workshop. I finished my session, 2.5 hours session. I got up from the chair and I collapsed. Checked my pressure, it was 80/60. So I contacted a colleague of mine and says, stop all your antihypertensives. Never done that way, but I had to. And I was off the hypertensive medication for a full 3-4 years till I started traveling again. Okay? You can reverse that. My sugars went down. I was having only 1 tablet. That was because of my psychology. Everything reversed. I had lost weight. I didn't even intend to lose weight. All right. So it all depends on a lifestyle. We cannot adhere to that lifestyle with our current pressures, work pressures. The fact that we live in an urban setting. If we had to migrate from here to the Himalayas, probably we can reverse all aging. It will add at least about 20, 30 years of good life to our years, or good years to our life. But the problem is the environment that we live in. That's it. The kind of work schedules we have, the work pressures we have. If we can push that away, we can reverse any aging and get our age, our biological age down. And it has been proven, okay? It has been proven it can be done. Modern medicine has proved it.
Amazing. Again, I'd like to acknowledge you because coming from a fully qualified doctor, he didn't talk about a hack. He didn't talk about medication. He didn't talk about supplementation. He's talking about basic lifestyle medicine.
Yeah, so that's best.
That's brilliant. That's brilliant. Now, doctor, you've treated over 30,000 patients with chronic conditions. What patterns or causes keep showing up?
So earlier it used to be a lot of heart disease in 40, 50-year-olds even, but it was not a kind of a galloping heart disease. It was not something which was giving you bad outcomes. It was heart disease. You were getting angina. You went and did an angio. You had certain blocks. It was chronic heart disease. And we were treating that with chelation and a whole lot of other things. Now you get a lot more people coming to you with already a heart attack, which is bad in a way, because now you have certain area of your heart muscle already damaged. And we see a lot of people coming with heart failure, which we were not seeing earlier. And so to recover from that, though we have good drugs, you need a lot of other things to recover from that and reverse that. And we have been doing that as well right now. So that is a difference that we see now as far as heart disease and cardiometabolic issues are concerned. Second, because of the way we are playing around with a lot of drugs today for weight loss, especially things like Ozempic, which are GLP-1 analogs and things like that, you are seeing a lot of side effects which they don't mention. Like, to start with, I had never seen pancreatitis in many of my patients earlier, but the newer diabetic drugs are causing that. So unless you know how to handle it and how to use those drugs properly without getting the side effects, you should never kind of play with this, right? They are drugs anyway, they're chemicals. We see that. Like I said, we see a lot of cancers now. We do a lot of patients, even when they come to us, we never tell them that your cancer is going to go away. But I think you can live with your cancer and you can take the cancer and go to the grave rather than let the cancer take you and go to the grave. So it's all your mindset and what you do to keep the cancer at bay, even if it is there. 90% of the time when patients come to us, they are in a hurry. They are in a tearing hurry to get rid of the cancer. And that is the biggest problem because they are anxious. That anxiety itself kills them. Right? So we first do a lot of counseling. So it's a five-pronged attack that I have. I look at your nutrition, irrespective of what you're suffering from. We detoxify you because without detoxifying you, I can't do anything. So chelation comes in very handy there. The moment I detoxify you, all your arteries have collaterals opening up. So your heart disease is automatically reversed. We detoxify you. We provide you with a hormonal balance because we look at all your hormones. Specifically when it comes to insulin, cortisol, DHEA, which is the mother hormone, and thyroid. Thyroid being one of the most important. We kind of try and balance all of this. Then we look at your mind, and there's a lot of counseling involved there, and how you can actually live a calm, cool life if you're grateful for everything and you live in the present, not in the past, not in the future. So if you're living in the present, you're not worried about your future. You're grateful for what you have right now. And that is something we try and instill in most of our patients. And the last, but the most important, is how strong your body is. So we ensure that every patient does, and we give you videos even for that, ensures that they do that exercise on a regular basis. Now, I can tell you with all certainty that more than 60% of the patients don't do half of the things that they're told. And they still get good results. But if they had to do the entire thing, they would have reversed a lot more. Right? But this is something that we do for most of our patients, and that's kind of given me a lot of satisfaction. For example, yesterday, I had this lady who came up to me, and she came to see me after 6 months. And I was looking at the papers that my assistants had kept, all her history, everything. So the first question I asked her is, how are you feeling? And she said, doctor, when I came to you, I had all these conditions, and life was a struggle. And today, I'm extremely happy, and I live a normal life. I think you can't ask for a better outcome from a patient within 6 months. Right? This was in Bombay. So I felt really good, and I asked my assistant, I said, do you feel good? Because you're the one who was handling her. She just followed what we had to tell her, including leaving out certain food items from her food.
I really like this approach. One of the, I would say, distinctions I wanted to make, you were talking about heart failure and a heart attack. For our viewers, could you tell them what the difference is?
Okay, so a heart attack is when your blood supply to a particular part of the heart stops. And so that area gets totally damaged, right? There's a scar tissue formed there. Now, you would normally not die just because the heart supply has stopped for a short while and that area is dead. What happens is, because of that, your electrical impulses of the heart are affected. So your pumping goes into a disarray. And you can get a tachycardia, SVT, supraventricular tachycardia, or any of those, and die because of the tachycardias you get post the attack, the heart attack. So that's called an ischemic infarct, basically. Now, heart failure is, now this area has already got, so if you look at your palm, let's say this area has been infarcted, it's got a scar tissue. Now, this is scar tissue. It is no longer a proper muscle. And the heart is a muscle. It needs to work 24/7. So, pumping becomes slower and slower. The energy to the entire heart muscle goes down. And heart failure is a chronic condition that results either from a heart attack or generally from decreased blood supply that the heart can't pump. So what will happen? It's like a water pump. Water pump, if it's supposed to get 210 volts, if it gets 180 volts, it will still function. But at some point, it will burn out. So similarly with the heart, if the blood supply to it, which gives you oxygen, which gives you energy, decreases, it will still keep pumping 24/7. But it's pumping 24/7 at a decreased oxygen. That leads to the heart slowly failing. The heart cells, which are called as myocytes, they start dying. That is heart failure. Here, so an ischemic heart disease has both components. One is the ischemic part of it, which can lead to heart attack, right? That's an immediate thing. It's a very acute event that happens. Heart failure is a slow-moving thing that it moves there. So how would you know that you're having heart failure? What people don't realize is when they do an echo, if there's diastolic dysfunction. What is diastolic dysfunction? It is when your heart relaxes for the blood to come in. The relaxation takes more energy than pumping. So when this is affected, you know that there is already decreased energy supply to this heart, which will in the long run lead to heart failure. People don't look at that. You see some of them, diastolic, grade 1 diastolic dysfunction, normal echo. People are not bothered. But the energy supply to that heart is very important. And so here, besides you doing whatever else you do, you need to give nutritional supplements that will increase the energy supply to the heart, which nobody looks at. That is where nutritional supplements come in. You need to use supplements with a specific purpose. Otherwise, don't use them. Don't just use vitamins because vitamins are good. Each vitamin has a purpose. Use it because of that. People use folic acid. For God's sake, folic acid will do more harm to you than good. You need to use folate, which is a methylated form of folic acid. I'm just giving you a simple example. Everybody likes to have folic acid. You use a B complex, there's folic acid in there. The whole B complex is bad for you because that folic acid is going to do more harm if your methylation is affected. Nobody looks at it. So there is a science to even giving you proper supplements.
Wow. Scientific understanding is far more important than just run-of-the-mill advice, especially that social media advice that goes on, right?
Absolutely, absolutely.
So, Doc, how do heavy metals and toxins impact aging and diseases like diabetes or heart disease?
That's a very good question. Now, to understand this concept of how heavy metals affect you, one of the easiest ways to look at cadmium. Right? Now, let me explain this to you. This is one of the ways, and there are many other ways. One of the ways is something called mimicry. And this is one of the commonest. For your thyroid function to be active, that means what your thyroid gland is secreting is T4 and T3. Now, it secretes major part of T4, 80% or 75%, and 20 to 25% of T3. Now, T3 is your active hormone. Its activity lasts only for 4 hours. It's the highest in the morning because that's when the thyroid hormone is released, right? And so you have 4 hours of T3 activity. Now, after that, T4 needs to get converted into T3 in the rest of your body, right? Now, for this conversion, you need zinc. Now, this is a normal mineral, zinc. Now, zinc sits at particular spots on the thyroid, on various parts of your body where this conversion is required, and T4 gets converted into T3. Cadmium, when it gets in, now how will cadmium get in if you're smoking? Or if you're on the road, because radialization of tires uses cadmium. So as the tire wears out, you're breathing cadmium. So you get very minute levels of it. So you're not really poisoned. It's a slow, chronic toxicity that gets into you. Now, cadmium gets into your body. Cadmium mimics zinc and goes and sits at that same spot where zinc would sit for the conversion of T4 to T3. Now, this conversion doesn't take place. So what has the heavy metal done? It has gone and disrupted a very important biochemical reaction in your body that has huge repercussions on your body. Low thyroid will give you everything from weight gain to loss of hair to constipation to breaking of nails to mood swings to everything. But we don't attribute it to heavy metal toxicity, right? We say you've got low thyroid. And so what do we give you? We give you T4. But T4 doesn't convert to T3 because it doesn't have zinc there. It's cadmium blocking it. We don't look at it. One way. The other way is the oxidative stress that we spoke of. Oxidative stress just zooms up. And this is specifically when you have heavy metals like mercury. It affects your brain, the central nervous system. There, the oxidative stress plays a huge role. Your Parkinson's is oxidative stress in a particular area of the brain. All right? You need to have antioxidants there. That's the only way that you will stop the oxidative stress. So you use antioxidants which are also chelators, like alpha-lipoic acid, which will throw it out. High-dose vitamin C. You don't do it in a pro-oxidative dosing that we do for cancer, but you still do high doses, which are antioxidant doses. Now, these are some of the things that tell us that heavy metals do play a big, huge role. You detoxify, patient starts getting better. Now, when it comes to heart disease, for diabetes, it's cadmium again. It's known, there is enough evidence to show that cadmium causes causes diabetes. But for heart, it is lead that plays a huge role. We in modern medicine know this. There was a study called NANS2 done towards the second half of the 90s, 95 onwards, which clearly showed that lead causes cerebrovascular disease, that is heart disease. Cerebrovascular disease, and also it affects the brain and causes strokes and things like that. So it actually showed that lead was directly involved. Now, we've never used that information, ever. Now, if I am going to give you an anti-anginal for pain because of angina, what am I doing? I'm giving you a Band-Aid treatment. If I do a bypass surgery or even an angioplasty, what am I doing? I'm giving you a Band-Aid treatment. Why? Because the actual cause is left in your body. I need to detoxify you of the heavy metal. So the moment I pull out the heavy metal from you, what happens? The heart has a lot of collateral circulation that is available. In that, if the arteries are blocked, what are you looking at? You're looking at the 3 major arteries sitting on the top of your heart. Not the ones that are going down. They are also blocked. You have atherosclerosis setting in everywhere. Now what happens when I give you a chelator, inhalation, to remove the lead out? When the lead comes out, the cause of this block stops, is removed. As a result of which, collateral circulation opens up first. So you get a natural bypass. When you get a natural bypass, you feel good because you don't have the symptoms anymore. I have not removed the block out. So I'm not competing with a guy who says I'm putting angioplasty and opening up your block. I'm not competing with a guy who's doing bypass surgery. I'm doing something totally different. I'm going to the root cause of your problem and removing the root cause of your problem. Tomorrow, if you still want to go and do a bypass, please go and do it. Your bypass will last you longer than otherwise because you have removed the root cause out. If you don't want to do it, you still don't have symptoms anymore, so you may not do it. That's for you to take a call on. I'm not going to be the one to tell you. But removing the heavy metals out saves you from cardiovascular disease, that is your heart, and cerebrovascular disease, that's your brain.
Amazing. Okay, so you've partially answered my next question, which is, what is chelation therapy and when should someone consider it? Is it safe and effective?
Okay, so in the US, where the whole thing started, there were more people doing chelation than going for mainstream treatments for heart. And so somewhere in the late 90s, early 2000, there was a full TECT study done. TECT is trial to assess chelation therapy. There were 2 questions asked. Is it safe and is it effective? Both were answered in the positive. So modern medicine has answered that. It's safe. Is it effective? Yes. In certain conditions, they said it was effective. They said if you're a diabetic and if you had an anterior heart attack or anterior area which was affected, that's the LAD, it's very good. Post that, I must qualify and say that post that, there was TECT 3, TECT 4 and TECT 2 that were being done. And obviously, a lot of time has elapsed since then, 12 years. More drugs have come in. And so people are taking more of those drugs because the drugs are never stopped, right? So with the new drugs coming in, they said that chelation won't have much of an effect if you're doing anything because these new drugs, without even surgery, you can live with the same thing. And chelation also, you can live with it. So that is the status as it is now. But what people have not really looked at is because, see, when we do studies, we do it with a specific purpose. Is this okay or not? It's never looked at as a holistic thing. Now, unfortunately, modern medicine treats the human body as parts. I repair your heart, I repair your brain, I repair your kidneys, I repair your liver, that's it. But please understand that everything is interconnected and everything affects one another. That is not looked at. So when you actually do chelation, you are improving the blood supply to your entire body. 1. Number 2, you are removing the oxidative stress of your entire body. 2. And it also removes the thousands of biochemical reactions that have been blocked because of one heavy metal, which are affecting various organ functions. So not only does your heart get all right with chelation, the whole body gets a kind of an oomph. You feel fresher, you feel younger, you do a lot of things that you wouldn't do if you had not done chelation. And I don't speak this just out of my patient experience. I'm speaking it from my own personal experience. I had a heart attack at 44. I was asked to do a whole lot of things. I didn't. I did chelation and I lived the next 15, 20 years with no problems. Right? So you need to believe in what you're doing, otherwise don't do it. Don't do it because I'm saying it, but I'm giving you concrete modern medicine evidence that chelation will remove heavy metals. If you remove heavy metals, you have a whole lot of improvement in the way your body is functioning biochemically, and that is very important.
So this is not just theoretical, it's lived experience for you.
Yes.
I mean, the fact that you were able to improve your quality of life,
Absolutely.
feel like $1 million now,
Absolutely.
and you coming from a heart attack,
Yeah.
recovering from that, and feeling like $1 million now. That's amazing. So that's lived experience.
It is.
That's brilliant. Another thing that really stood out for me when you said that modern medicine doesn't look at look at health holistically. It's very symptomatic.
Exactly.
Would you want to say more about that?
Yeah, because we are looking let's look at a heart disease, for example. You're looking at only what is the cause of the heart disease. You're not really looking at the rest of the body. You're not looking at what your stress levels are. You will only blame the stress as the cause of your heart attack, nothing else. Have you, when you go to a doctor or a cardiologist, does he attempt to look at what the causes are for your problem? And if he does, and he says stress, what does he tell you? He tells you, you have to reduce your stress. Does he tell you how? All right. I still remember when I got a heart attack, I asked my doctor, I said, I need to get back to my workouts. How do I start working out? He said, yeah, start slow, go slow. What's the meaning of that? Right? So generally, we don't give advice to our patients other than writing a couple of drugs to them, thinking that the drugs will sort it out. If we had to put, so I'm not at this extreme, I'm not at this extreme. I need to use the best that modern medicine can give me and the best that functional medicine can give me, and then marry the two. And when we do that, you get the best patient outcomes. And there's a lot of good in modern medicine. There's a lot of good in functional medicine. And if you take either extreme, if you take an extreme view in functional medicine, you will not get the same, you'll get very similar outcomes that what modern medicine gives you, which are not really great. But if you take advice from here and put it together, that's where it helps. And so when you look at heart disease, for example, it's one of those areas, cancer is another one, it's one of those areas where if you used ideas from both sides, the patient outcomes would be far higher. The one thing that modern medicine actually misses is looking at the person as a person. And the other reason why I say this is I have got patients. I'm a geriatric physician. So I have a lot of old patients also come out. By qualification, that's my speciality. So a lot of old patients who come to me. And they have got something called polypharmacy. And you know what's polypharmacy? That's something that is taught to us in geriatric medicine. Always look for this. Today, the role of a family physician has gone away. I have something in my heart, I go to the cardiologist. Suddenly started feeling faint, I go to the neurologist. I have some kidney stones, I go to the nephrologist. And all three guys are giving 3 different prescriptions. They don't have the time to see what you have got. And at times you're taking 3 different drugs with 3 different trade names, but it's the same drug. And so instead of taking a particular dose, you're taking 3 times the dose. Aren't you going to have side effects because of that? Right? So this is the reason why I say we don't look at a person as a whole. I mean, it is evident, and we are taught this. Please look at the prescriptions that different doctors give. Whereas when you had a family physician, and in some societies across the globe, there are family physicians. You can't go to a cardiologist without the family physician referring you to him. And the cardiologist sends the patient back to the family physician so that the family physician then rationalizes the prescription. That doesn't happen in our society in India, unfortunately. Right? That is my contention. That is why I say modern medicine doesn't look at a person as a whole.
That's brilliant. Look at the person as a whole, not as a patient. That really stood out for me. Looking at a person. See, this is when you even talked about best patient outcome. So those keywords communicate to me there's a whole missing element in modern medicine, which is care.
Yes, I agree with you on that.
I think, when we talk about the placebo effect, how patients start feeling better when they know that they're genuinely cared for. I mean, we can talk about functional medicine, we can talk about nutritional supplementation, we can talk about biohacking, we can talk about all those physical things. But if a person is not treated as a person, if they know they're not getting the care and the empathy that they deserve, then I think that's a whole element of healing missing, isn't it?
Absolutely. And that was one of the major causes of so many deaths during COVID, right? Mm. You put people in ICU setups and isolated them from their loved ones. They practically died there out of loneliness. The human care was missing. The human touch was missing. Strangers around me. In a frightening world, we don't know what's happening. The anxiety kills you. It's the same limbic system, putting you in a fight or flight mode. When you're in a fight or flight mode, Everything of yours shuts down. So where's the healing process? You can never heal when you're in a fight or flight mode. And you get into a fight or flight mode when you get anxious. And when do you get anxious? When you don't understand where you are. When everything around you is very cold. Care is missing. You will see two good cardiologists getting great outcomes. One getting great outcome, one not getting outcome at all. Both are equally good in their practice, giving you the same medications. One guy has time to tell his patient you're going to be fine. The other doesn't have. That's the difference.
But that really also speaks to the way our healthcare system is structured. You go to a hospital, you go to critical care units, you go to general wards. That's how people are isolated. Where's the care element? It's cold, as you said, right? So I'm sure the healing takes a lot more time, and a lot of times it's not even there.
That's true.
We really need to relook at the whole thing, right? Doc, many of our listeners are women in their 40s and 50s navigating perimenopause. How can BHRT help with aging, energy, and skin?
Oh, great question. Great question. See, so first we need to understand what is BHRT. For me to explain to you what BHRT is, let's start with water. So water, H2O. If I add an oxygen to it, what does it become? H2O2.
Correct.
So it changes completely. It becomes hydrogen peroxide. Can you drink hydrogen peroxide?
I don't think so.
You can, but you'll get burnt in the process as well. Okay, you won't die out of it. Hydrogen peroxide is good for you. We've used it a lot, but a very minute, diluted manner. Similarly, if I take any hormone, naturally occurring hormone, and I add something to it and change its structure, does it remain the same? No. So, BHRT is nothing but bioidentical hormone replacement therapy as against HRT, which is hormone replacement therapy. Now, HRT is used in many ways by modern gynecology, obstetric gynecology, for handling many conditions. It has its benefits, and it has its side effects or downsides as well. Prolonged use of HRT can cause you massive problems. All right? And when it comes to a good life, you need a prolonged use of a hormone, whether it's progesterone or estradiol. These are prolonged uses, or DHEA, these are prolonged uses. Now, if it's a chemical that I have created in a lab by taking the normal hormone and adding something to it, there is no normal level of that in your body, is there? But whereas if I supplement your body with what is there in your body identically, I'm able to measure it, right? Because it's there in your body. So it'll either go up or go down, or have no effect, right? So BHRT has those benefits. Secondly, any hormone in the body, whether it is estradiol, which is the female hormone, progesterone, which is the female hormone, testosterone, which is the male hormone, all of them don't only act on your sex organs. They act on your entire body. For example, the largest number of receptors for progesterone and testosterone are in your brain. Now, when you change the naturally occurring form of it and give it to you, it will act only on your targeted organs, which are your sex organs. So it doesn't give you the benefit of the entire hormone. For example, progesterone ensures that you have a great mood, right? Testosterone, for that matter, keeps you calm and cool when you have the right testosterone, because it gives you that confidence. Why? Because of the receptors in the brain. But if you start changing and playing around with your chemical structures, that doesn't happen. Okay? So BHRT is that. For females, it is basically that. We sometimes cycle it depending on what is required for the patient. Many people come with mood swings, and it normally happens between 35 and 45, where progesterone first goes down. So we just supplement progesterone. In India, it is better because most women have high amount of estrogen. Too much of estrogen without the balance of progesterone will cause them to have fibroids, fibroadenomas, breast cancers, things like that. Because you have certain metabolites of estrogen that do lead to cancers, okay, that are risk factors for cancers. So you don't want too much of estrogen in a female body. So when we do the tests, we can make that out. And when we supplement, we know that we can supplement to a point that the physiological levels are maintained. If it goes up, I can control the dose and bring it down. Secondly, most of the BHRT work that is done with transdermals, with creams, with gels, with pellets. We don't use too many pellets in this country, but overseas they use pellets. Here we do it with gels and creams. So it's a slow absorbing. It bypasses the liver, so the first pass effect of the liver is not there. There's no load on the liver. It goes directly to the target organs. It goes where it has to go. And your levels go up very slowly. So you won't have any immediate side effect because of that. The side effects are much lower. The problems that come out of excess also are slower, because for it to reach excess, it's going to take a long time. All right. So BHRT is very safe. Now, how does it help a woman? For example, when the patients come to us with very heavy fatigue, we check their thyroid hormones first. We can supplement that by just giving you iodine. Iodine helps your thyroid levels to work. It helps your thyroid. But more importantly, iodine is the best mineral to keep your breast health in good shape. Nobody looks at that. I use something called live source iodine, which comes from seaweed, which is the best thing that you can use. All right? Lugol's iodine was used in the good old days before all this thyroxine and everything, L-troxin and all this came up, because it was the best way that you could get your thyroid working properly, whether it was high or low. We still use those methods to try and get the patient's thyroid to function, rather than straight away put them on some thyroid hormone. Your cortisol levels are up or low. We also help you using herbs like ashwagandha and rhodiola. If your cortisol levels are really low, a good black coffee in the morning at 10 o'clock can raise it. So we do that. But we also tell the patient what the downsides are at times and how they should handle it. And so when patients start using this together with the right nutrition and the right lifestyle, which includes exercise and sleep, that's when you see the magic happening.
Right. And what's your take on labs? I've been told by doctors that about 20 to 30 years ago, let's say if we were to look at fasting sugar or even the thyroid levels, the lab results had a larger variation than today. Like in terms of the ranges were much bigger as well. And now the ranges are shortened as well. So is it because we found out there's been research that, your thyroid levels are out, your T3 and T4s are out because of those lab results? Or is it because the ranges are narrow because it's a pharmaceutical thing?
So that question is correct, not in the hormone field. If you're looking at natural hormones, like I'll explain to you. Thyroid, for example. If you give too much of thyroid, the patient can't tolerate it. Starts getting palpitations. So nobody's going to benefit from thyroid. And thyroid is the cheapest medication that you get in the market. Now, where this comes in, this is a fact, is when you look at cholesterol levels, because cholesterol is a big market, $60 billion market for cholesterol drugs. Diabetes, the sugars, the range is shrunk. It could be there, because today they say anyone above the 120 mark is diabetic, right? But I know for a fact that even at 140, patients are doing fabulously well, right? So in the cardiometabolic segment, this is probably true. Just look at the cholesterol thing as well. You can't have the same cholesterol levels for people who don't have sunlight and for people who have sunlight, right? Your cholesterol levels will be much higher because you need cholesterol to make vitamin D. And most of us have low vitamin D anyway. So you can't have a standard cholesterol level for people in Scandinavia and the same for in India. But that is still followed in the same manner. So there is something here. You need to think and say, hey, there is something beyond what is normal here. This is something because of the commercials that are involved.
Right. No, I agree. So you gave us a great introduction on this, but I still want to ask you, what role do hormones like estrogen, progesterone, and testosterone play in longevity?
Oh, so let's so one of the reasons why you age is because your hormones have gone down. Now, The moment your progesterone and estrogen start going down and you get into menopause, as long as you had good amount of estrogen and progesterone, women never had cardiometabolic disorders. They're protected from it. If you have got your cardiometabolic disorder before you went into menopause, it's because you have an imbalance of your progesterone and estrogen. Finished. Simple. It's only post-menopause that people start developing diabetes, hypertension and other things. Hypertension is more seen, and there are studies done on this, because there's a lot of heavy metal sitting in your bones which come out when your estrogen levels start going down. So you age much faster. Now you don't want that to happen. At the time of your perimenopause, you start replacing your hormones and you shift your hormonal levels to when you were 25, 30, your biological age will reach 25, 30. You understand what I'm saying? That is the way. Now testosterone, very important for heart health. Very important for your body structure to be strong and fit. Your testosterone starts going down, that's when you have trouble. Your testosterone starts converting to DHT, you get into balding. The worst, when your testosterone aromatizes to estrogen. I can't do this in a lab, but my liver does it. Your testosterone, as you grow older, starts aromatizing to estrogen. When that happens, your heart disease will start coming in, because estrogen in men causes heart disease. There is some amount of estrogen, but if it goes up beyond a particular level, it's going to cause heart disease. So it's an aging disorder. Now you put in enough testosterone and ensure that that testosterone that you're putting in, because your testosterone is low, is not going to convert into estrogen. You're allowing that person to have many more youthful years.
So, Doc, that was very insightful, and I don't think there's enough conversation in the mainstream about hormones and hormone therapy, considering how it impacts our well-being in so many ways.
You're so right, Warun. Even for doctors, hormones are a taboo. Nobody wants to play around with that. I remember years ago when I started BHRT and incorporated it in my practice, one of my first cases was a female doctor. And when I gave her prescription to her, I wrote it out, explained to her how she has to do it, etc., etc., etc. She went and spoke to her professor. And he said, "Are you crazy? You should never be taking thyroid hormones. They're going to do this, that. And she never took it. And she continued being suffering from the exhaustion and from the fatigue. She lived her life that way. As a result of which, people don't use hormones because they're scared. They don't understand the outcomes. They don't know how safe it is if it is used right. And I believe everything in the universe is dangerous to you if you don't know how to use it, including drinking too much of water or including taking too much of oxygen. You have oxygen toxicity as well. But in the right amounts, everything can be a medicine for you. And so using your hormones well, you can actually live a much better, fuller life if you know how to incorporate those hormones when your hormones are down. We do it with insulin. We do it with thyroid. Why can't we do it with the other hormones? Right? People don't know and don't want to know. Because keeping you sick is better for the hospitals and modern medical industry. I'm not saying the doctors, but I'm saying the modern medical industry, because the doctors sometimes don't earn from it as much as the modern medical industry does. That's your pharma, your hospitals, your insurance companies, and everything around it. The whole ecosystem.
So I love that. Too much of a good thing can be a bad thing.
Absolutely.
Right?
Yeah.
As you said, too much of water, too much of oxygen. Sometimes we have a tendency as humans that this is good, so just stack it on, pile it on, right?
It causes an imbalance.
Causes an imbalance, causes toxicity.
Yeah.
Right. Thank you. Thanks for that. And also, doctor, how do you support energy, brain function, and emotional health in midlife women?
Again, hormones. All comes down to hormones. See, unlike a male where you have one or two hormones that play the role, in a female, it's a symphony. And in any symphony, if one musician is playing off, the whole symphony sounds off. So you just need one hormone to go haywire in a woman's life. The whole body starts going down.
So safe to say, women are more of hormonal creatures than men.
Absolutely.
Right.
But in both, you need to manage hormones during the midlife. Otherwise, the midlife age is where the tipping point is, whether you're going to have... See, we all will live long lives. But whether those lives have good years in them or sick years in them is when this part of your life, that's between the age of 40 and 50, decide. So if you decide to take charge of your health at that stage or even earlier, start balancing out your hormones. You will live a longer, fuller life, a healthier life, a life with less chronic degenerative disorders.
Which is the point of our podcast today. And brilliantly said, modern medicine today has definitely increased our lifespan, but has it increased the quality of our lives? Has it increased our health span?
No, I don't think so. That is where the problem is. That is where today people are turning to Ayurveda, hoping they'll find solutions there, especially in our country. And there are solutions there, but unfortunately the modern Ayurvedacharyas don't know about it. That's the sad part. They're looking at other areas, they're looking at everything possible, including doing yoga, going for retreats, etc., etc., etc. But the basic thing is getting your body to function normally. And that can be done if you address the 5 areas that we address. Remove the toxicities, balance your hormones, get the right nutrition, keep your mind calm and cool, and get a strong body.
Awesome, awesome. Doc, where do you see regenerative medicine like peptides, stem cells, or exosomes heading in the next 5 years?
So, again, a very interesting question, because this is something that most people ask me and they think that this is the elixir for longevity. I have some bad news for you. It isn't. Right? So stem cells do have a role. But if your body is full of toxins, stem cells don't work. So you need to do a lot of work before you add the stem cells into the mix. 1. When it comes to chronic degenerative disorders, for example, when we do people with heart failures, more with liver and kidney failures, reaching a point where they would need a liver transplant or a kidney transplant. This is 1 or 2 stages before that. But they're going downhill there and they're really bad. That's where things like stem cells and especially cord blood cells do work. And we have done a lot of cases with that as well. But that's still a gray area. And modern medicine does use it in a lot of things. When it comes to exosomes, it's great at the moment. Now, what are exosomes? Exosomes are cells that you get when you are actually growing the stem cells. These are basically waste, but they have all the growth factors that you need. And they are great for wellness. A patient between the age of 40 and 50, overloaded with work, really not having despite his good lifestyle, still having issues. He has a good lifestyle, goes to sleep on time, exercises regularly, has a lot of antioxidants that he has to have, goes to a good doctor, gets himself well taken care of, and yet he needs that extra oomph. That's when the exosomes will help him. Because exosomes will give you those growth factors to help wherever the body is aging to kind of slow down the aging process and kind of do some regenerative and repair work. So exosomes have a huge role to play, but they cannot be taken by anybody and everybody. You can't just walk in and say, I want to take a shot of exosomes. They're not going to give you the results that you want. You need to go through the entire gram. You need to get rid of your toxins. You need to get rid of your bad lifestyle. You need to sleep on time for them to work. Otherwise, they won't work. So yes, they have a role and they will keep growing. There's a lot of research going on. They will keep getting more applications used. But if you're going to use it the way you use modern medicine drugs, it's not going to work. And that's why it hasn't kind of ramped up very fast. We knew of stem cells for the last 50 years, 60 years. It's not a new phenomenon. I mean, the German scientists and doctors were using animal stem cells for human regenerative work, and they were doing it very well. So many of them still continue doing that, right? So, like, you get thyroid from desiccated thyroid. You get so many things that are done with cells that are from animal origin. But today we have human stem cells available. And we've not really reached a point to say, okay, this is how we can use it. Other than joints and certain other conditions, it's really not reached a point where we can say we can use it and we'll get a definite outcome out of it. And the reason for that is because we don't prepare the body and we think it's a drug that will sort all our problems out. It isn't.
So again, address the basics first.
Address the basics first, and then you can benefit from the advances in stem cells, exosomes, everything else.
Brilliant. Now, you're also an author, and you've got a great title, Is Your Doctor Keeping You Sick? Now, what inspired you to write this book? Your book title is, of course, very bold and intriguing. So what inspired you, and what's the core message you want readers to take away?
All right, so this book was something that I wanted to write because it was difficult to explain to people what functional medicine is and why we need to use it going forward. Now, this book was meant not to be a kind of a medical treatise for people to learn. It was both for doctors and for lay persons or lay people, for everyone to understand what this is all about. Now, the title, Is Your Doctor Keeping You Sick? It simply came from the fact that when I graduated, I used to tell my patients, especially diabetic patients, in your diet, you should eat wheat, chapati, and don't have rice. And when I entered functional medicine and I started looking at nutrition, the first thing I realized was both that chapati and that katori of rice or 2 katoris of rice had the same glycemic index practically, right? But the chapati was one that was keeping you sicker than the rice. Why? Because the gluten affected you, kept your inflammation in your gut high. And if the inflammation is there in your gut, your blood sugars are going to remain high. So what was I actually doing? I was keeping you sick so that you kept taking medications and made whom rich? The pharma companies. And so that stuck with me when I first got into functional medicine. And so I thought that would be an apt title for my book. I got the title first before even I started writing the book. And I announced the book even before I had written one line of it. And so I thought to myself, what I'm going to do in this book is just say what I do as a doctor, as a functional medicine doctor. What am I actually doing for a patient in all the 5 areas? And that is what I wrote in the book. So if people read it, they will understand what functional medicine is. I've also given 3 areas where it is used. One is cardiovascular disorders, all right, and how cardiovascular and metabolic disorders can be helped by modern functional medicine, and how we can help people with cancers, and how we can help people with autoimmune conditions. Those are the last 3 chapters in the book, right? And we've also, the other reason why this title was very important for me was it had nothing to do with the way modern medicine is practiced at all. I have not written anything about that. And I did not want to kind of downplay or downgrade the medical profession under any circumstances. But you see, the title of any book, and as an author, you look at a hook in the title. And this hook was not so much meant for the lay people as much for the doctors. Because of that, if even I had one doctor pick it up and read it and change the way he handles his patients, I would have achieved my objective of writing that book. So that was another reason why I stuck to that title. And so when it actually was published, many of my close friends who are doctors actually called me up and said, why did you put this title? I said, read the book and read the message that I have sent out in the foreword itself, in the first intro itself, to all my colleagues. All right, because I believe that many doctors are working with at least one hand tied behind their back. They're forced to do things that they might not want to do. And so it was never meant against the medical profession. It was meant to enlighten the medical profession that there is a world beyond what we are doing.
So you definitely ruffled some feathers with the
yes,
title.
Yes, I did.
Okay, great. But again, very humble of you to describe your lived experience of how you were prescribing from a wrong angle until you learned about functional medicine, until you learned about nutrition, until you learned about a whole world beyond medicine.
Absolutely.
So, suffice to say, or would I be right to say that doctors, if they haven't pursued functional medicine, or if they haven't gone out of and explored the world beyond what they know, that means they haven't studied nutrition, that means they haven't studied supplementation, that means they haven't studied lifestyle medicine?
No, we were never taught all of this in college. At least when I did it. Now there are some subjects to that effect. How good they are, we don't know. Because when you look at dietitians, they're still prescribing a lot of bad diets. All right, so I don't think it has really percolated well in there. But yes, doctors, no, we are not taught, or we were not taught nutrition at all, right? I think the first nutrition question I ever got was my final year viva. Was what was the calories in the 2 bread slices you ate this morning? I thought it was a stupid question for a final MBBS student, but I got that question. And so we were never taught nutrition. Lifestyle, yes, when it came to chronic. So chronic disorders were, so why modern medicine is failing today? And why did it do really well maybe 50, 60 years ago? Because it could give you quick fire shots or quick solutions to infections. I give you an antibiotic, your infection goes away.
At what cost?
Yeah, but that we didn't understand then. Now the cost we are looking at because of all the resistance to drugs and all that, we never thought of it then. That's how modern medicine became big in the early 1920s, 30s. In the 80s, when chronic degenerative disorders started showing up, they thought they would be able to solve the problem straight by giving the same drugs. That really didn't happen. And that's why there is so much of a conflict today. And COVID has taught everyone a lesson. If you were looking at the root cause of a problem, many people wouldn't have died of COVID. You don't need a vaccine to get rid of COVID. COVID was a virus. Even if it was man-made like many people or many doomsdayers believe it is, simple things very early in the disease would have sorted your problem out. People who did that saved themselves.
Even what boggled my mind during COVID, as you rightly said, COVID was a virus or is a virus. And a lot of medical community was prescribing antibacterials, which did not make any sense to me at all.
Yeah, so they did because they didn't know what to add. Some of these antibacterials, like Doxy, also works as an antiviral. But that was not the case. The case was we forgot some very basic rules. What was causing the problem for the patient? The histaminic reaction caused by the virus. We never added antihistamines to that. You look at the guys who had the maximum, you look at Shankara Chetty in South Africa, who's a good friend of mine. His rise to fame was because he knew exactly what was happening with the virus, what the virus was doing in the early part of the disease, what it was doing in the later half of the disease. And he used the right medications at both times. Medications that were available and cheap. What the entire medical fraternity was looking at was some new drug which could easily solve the problem. And none of them did. We added Remdesivir, which basically was not even a drug that worked where it was supposed to work, as a trial, and people died because of that.
Damn. And it was as simple as figuring out that this is causing an antihistamine reaction.
Yes,
so you
initial
just need
part.
to add that. Wow.
And the later part was something else. And there were solutions available. It's just that we didn't pay the right attention. And that is what happens when you're looking at only a very narrow area of what you do. If you're looking holistically, you would have been able to sort the problem out.
Wow. Again, on to your book. What patterns did you notice in traditional healthcare that made you feel patients weren't truly getting better, but were simply being managed?
Yeah, so if you look at a person who's to come to me with hypertension, his hypertension never got better. I kept giving him another hypertensive if his pressures went up after 3 months. What was happening? Was I only managing the hypertension? Diabetics. Well, are we only managing the diabetes? These are the two major drugs that are being sold worldwide, right? Antidepressants. Have you seen anyone taking an antidepressant get out of an antidepressant? It just keeps adding on. And one of the reasons why antidepressants don't work really for you, because one of the side effects of antidepressants is weight gain. And when you put on weight, that itself is a trigger for depression. So you need more antidepressants, for God's sake. And one of the hormones that gets rid of all the antidepressants? Progesterone, especially in women. It also gets rid of a lot of anti-epileptics, by the way.
So that's a catch-22 there.
Yeah.
Right. Wow.
So we have seen these patterns in modern medicine with every chronic disease you look at. And there is so much of misdiagnosis. People don't want to look at, let's say, adrenal fatigue. Adrenal fatigue is not looked at by modern endocrinology. They say this particular thing doesn't exist. But those symptoms are real. And they turn out and say, no, this person has got psychiatric issues. Go and see a psychiatrist. These are facts. I have got patients who keep coming and telling me.
Amazing. You're right. Even I've read a lot about it that, it's not established in the medical science like adrenal fatigue. It's all woo-woo stuff.
Yeah.
Apparently.
They say that this is all, there's no scientific basis to it.
But you see it. In your practice, you see it's real.
So we've even explained it. If you look at certain levels of your cortisol and DHEA, you can actually say whether this patient is in adrenal failure or not, or adrenal fatigue or not. Not failure, fatigue.
Got it. Another related question would be, what are some red flags patients should watch out for that suggest that the doctor may be keeping them on a sick care treadmill rather than on a healing path?
So I'd say if your medications are increasing every 6 months, then you're on a management of the disease. If you can hold on to the same medication for years, that means you've been able to look at the root cause and block the progress of the disease. Now, how much to reverse that? At times, even for me, I tell my patients, don't go for reversal. Let's stick with this, because at this age, I don't want you to put in too much of effort in reversing the disease, because that itself can cause a lot of anxiety, and then we have to handle other issues. Right? So at the end of the day, for me, like I said, I don't go extreme right or extreme left. Follow the middle path, because at the end of the day, the patient outcome is important for me. What is the patient looking? Now, if the patient says, I need to reverse disease at whatever cost, then I don't have a problem. I can tell them, there's other ways that you need to reverse it. So the red flags are, if you do not feel better despite the medication, but your numbers are right, and then after some time the numbers also go haywire and you have to increase the medication, you know that this is sick care.
Wow. Yeah, I heard this long time ago that there's a mechanism in your body that if you don't look at the labs, if you don't look at the reports, this mechanism in your body will tell you how good you're doing, which is how good you're feeling about yourself.
Absolutely. See, I'll tell you something. Every patient that comes to me with thyroid issues, okay, how do we do this? It's very simple. Patient will come and tell me, I'm losing a lot of hair. This is most women, and they're very, very particular about hair loss. So I'm losing a lot of hair. I'm putting on weight. Before they can go further, I said, and you are constipated? And they say, yes. And I said, do you break some nails sometimes? And they say, yes. And so I say, you probably have a hypofunctional thyroid. And the next statement from their mouth is simple. No, doctor, but I just did the thyroid test and they're all normal and my doctor says thyroid is normal. This is 99.9 times out of 100 that a patient speaks. This is the conversation that we have. And I practically replay this conversation every day in my clinic. Every patient tells me my thyroid is normal. Absolutely normal. And then I have to sit for the next half an hour and explain to them how T4 does not get converted into T3. That's why she's having the symptoms of hypothyroidism, because your T3 is less, the active hormone is less. And then I have to actually do blood tests for them and show them how their cortisol levels are high or low. Because if they're high, they're still in active stress. If they're low, then they have crossed the threshold, their adrenals are fatigued, and they've stopped putting out cortisol. So after being high, they've come low. But in the process, they have shut down so many other systems. And then when we start that slow journey over the 6-month period, everything starts coming back to normal, without actually taking any thyroid medication, right? So this is something which is very, very common today.
So this is where experience of a true doctor comes in, that the labs are not showing it, but it's there.
It's there because the symptoms are there.
The symptoms are there.
And the lab also shows it. So if you look at the right marker, the lab will show it. The blood never lies. You look at the right marker, your FT3 levels will be low. Nobody looks at it.
So a lot of the times we're looking at the wrong markers.
Absolutely. That's another problem. I can tell you, for a lot of my patients, looking at one marker, that even if you do your surgical interventions, you will still come back to me in 2 or 3 years with the same problem again.
Damn.
Looking at your blood tests and certain markers, I can tell you within 2 to 3 years you're going to be diabetic. Even if you're thin and athletic and you do a lot of good things that you're supposed to do. So markers don't lie, but you need to look at the right markers.
Got it. Okay, so if someone listening feels like their current care isn't truly helping them thrive, what first steps would you recommend they take to advocate for themselves and find real solutions?
Yeah, so one of the things that I tell my patients is you need to get a proper lab test done. Looking at the functions of most of your hormones and certain markers that most people don't look at. I have it in my book, what are the markers that you should look at. It's very clear. And most functional medicine doctors will tell you this. So if you find a functional medicine doctor anywhere around you who can do a proper testing, he will be able to explain to you what's missing. That's the first step. You need to know where you are. And it's only when you know where you are, the next step is where you want to go. Then you kind of mark your journey, how you want to go. What are the dots that you want to fill in? It's a very simple process. It's not rocket science. But the first thing, get a proper blood test done. Get your diagnostics proper.
Got it. What do you hope this book will awaken in the average person about their health and their power to change it?
For one, I'd like to tell everyone that the state of their health is in their hands. And if they know what to do, they can. The book has a night routine that we have put down. Everyone who's got insomnia, go through that night routine. Follow how you do that night routine. Do it ditto. And tell me 3 months down the line if your sleep problems have not gone. With no sleeping pill. The maximum you're going to take is melatonin.
Brilliant.
Right? And melatonin is not a sleeping pill, for God's sake. It is an anti-aging molecule. And it's one of the safest. And you can never overdose on it. And you're never dependent on it. Okay? So, like this, we've got things put out in the book that will help you do things yourself. Going to the doctor is important when you know that you're not feeling good. Getting the right tests done is important. But at the end of the day, you have to do what the doctor tells you, for God's sake. If you don't do that, you're letting your health be in somebody else's hands. And that's a disaster. That's a recipe for disaster, for sure. So you need to take first the health progress, especially your own health progress, into your own hands. Understand what is happening. Ask the right questions, you'll get the right answers.
Brilliant. And I know a lot of people can benefit from the things you just talked about, especially having a good, solid nighttime routine. I know I've struggled with sleep in the past, and I know a lot of people who have. So I'm sure, get a copy of his book. It's on Amazon. Where else can they find a copy of your book?
So Amazon, Flipkart, you have a ebook available. It's available on all Kobe books. Your Kindle has it. There's a Kindle version.
Fantastic.
It's available, and it's priced very, very low so that anybody and everybody can read it.
Fantastic. All right, Doc, so I've got some rapid fire round for you. You
Done.
ready?
Shoot.
Okay, brilliant. One supplement you take every day.
Magnesium.
Most underrated test for aging or disease prevention.
Fasting insulin.
IV drip or therapy you recommend most often.
Glutathione followed by Myers drip, which is vitamin C.
One myth about aging you want to bust?
Aging can be treated and to some extent reversed.
And what do you do daily for youthful energy?
I sleep well and I work out every day.
Love that. Love that. Dr. Da Costa, this has been absolutely enlightening. Thank you for sharing such powerful insights. Before we wrap up, where can our listeners learn more about your work, clinics, or courses?
my website, drlennydacosta.com. We've got everything listed out there with the clinics. So I'm available in Bombay as well as Goa. Bombay, we go by the name of Rejuven Clinics, and in Goa, Rafael Medicare, where we are in Panjim and Margao. I do a lot of online sessions for patients from all over the country. And again, the data and the people to contact is there on drlennydacosta.com.
If this conversation inspired you to take charge of your health, don't forget to subscribe, leave a review, and share this with someone who needs to hear it. Remember, aging is optional and vitality is just one decision away. Again, Dr. Lenny, it was such an honor to have you. Thank you.
Thank you, Warun. Thank you so much.